There were multiple ones right now. There you go. Hello everyone, this is your favorite chiropractor Dr. Sanjay Sarkar. We are back with one more patient. Today our patient has low back pain. He will be telling us where he had pain, in terms of where in the low back, what is the rating of the pain and how many years he has been suffering from this pain.
यहाँ पर दर्द है और ये 4 से 4.5 साल पहले से दर्द हो रहा है, अभी भी दर्द है.
Between 0 and 10 कितना दर्द?
7 तो है.
7 है. अच्छा, का जो इधर दबा रहे हैं वो SI जॉइंट है. ये जो डिम्पल है, दोनों डिम्पल, ये डिम्पल इज कॉल्ड SI सैक्रोइलियक जॉइंट. SI लेफ्ट SI जॉइंट में उनका दर्द है. ये जो काम वो करते हैं उस हिसाब से शायद हो सकता है. आपको क्या लगता है, आप गिर गए थे या काम की वजह से, किस लिए आपको हुआ है, कैसे हुआ? बेसिकली
गिर गए तो याद नहीं है.
अच्छा,
काम की वजह से हो सकता है.
काम की वजह से हो सकता है.
बाइक चलाते हैं उसकी वजह से हो सकता है.
अच्छा, ये दिस इज अ वेरी इंपॉर्टेंट पॉइंट दैट व्यूअर्स माइट नोट. दोज हु राइड बाइक्स फॉर लॉन्ग पीरियड ऑफ टाइम may have sacroiliac joint dysfunction because of the jerking that they go under while they are biking, because our roads are filled with potholes. So please remember, if it is possible, prevention is better than cure, and the reason or how you can prevent it is by wearing a lumbosacral belt. Please buy a lumbosacral belt from online stores or offline store and wear it during riding bikes. That is very very critical for any prevention of slip disc, SI joint dysfunction, any lumbar spine dysfunction, overall low back pain. तो हम अभी ट्रीटमेंट करेंगे इनका sacroiliac joint dysfunction का. आप लोग देखते रहिए. तो हम लोग अभी sacral rocking करेंगे. This helps to move the sacrum on the innominate bone and also on the L5 segment of the lumbar vertebra. So SI joint and L5 S1 segmental motion बहुत अच्छा होता है इसमें. रिलैक्स हो जाते हैं पेशेंट. I am using one of my favorite modality, hyper volt hyper ice percussion gun on the SI joint and surrounding area, ताकि उनका जो आपका स्पैज़म हो या टाइटनेस हो वो थोड़ा सा कम हो जाए. So he is saying that sometimes it does radiate towards the hip joint. So that is possibly because of piriformis muscle tightness. But I believe it's all stemming from SI joint dysfunction primarily. अच्छा, आपको थोड़ा अभी क्या करना है, ये पैर उठाइए पहले, दाहिना पैर, ताकि हमको पता चले कितना उठ रहा है. जितना मैक्सिमम हो सके उतना उठाइए. वंडरफुल. ओके, ठीक है. अभी बायां पैर उठाइए. ओके, आप लोग दर्शकों देख रहे हैं कि दाहिना पैर जितना ज़्यादा उठ रहा था, बायां पैर उतना नहीं उठ रहा है. तो हमको इसीलिए पता चल रहा है कि SI जॉइंट में कोई डिस्फंक्शन है, इसीलिए वो पैर उठा नहीं पा रहा है. सो उसको बेसिकली व्हाट वी आर गोइंग टू ट्राई इज टू इम्प्रूव द एक्सटेंशन ऑफ द लेग by using one of my another favorite hammer and chisel, and to see if the SI joint is functioning better or not. ओके, अभी लेफ्ट पाटा उठाइए. लेफ्ट पैर उठाइए, उठा के रखिए, धीरे धीरे उठाइए. दर्शकों अभी खुद से ही देख पा रहे हैं कि पहले से कितना उठ रहा है. और उठाइए धीरे धीरे. एंड आई एम प्रीटी मच श्योर दैट इट विल इंक्रीज मोर देन द राइट वन. एज यू आर विटनेसिंग, राइट लेग के से ऊपर ये लेफ्ट लेग अभी जा रहा है. राइट लेग लगभग यहां तक आ रहा था और लेफ्ट लेग उसके ऊपर आ रहा है. So it is highly likely now we have managed the motion of the SI joint. It's kind of normal. Right now we will just set a little bit of the SI joint. Here, look at the dimple. That's where we want to focus on. There you go. Right? Fantastic. Again, left dimple. Now we are going towards the right dimple, right over here. Got it. I hope you listened. My mic is over here. I'm not sure if it was able to catch the cracks or not, but there was a nice crack there. There were multiple ones right now. All right, fantastic. All right, so now we will be using one of the very few technologies that is available in entire India. This is called Pulstar, as you can see it on the screen. We have the entire spine of the patient, obviously an animated version. We will be doing sensitive testing of the spine and check where the problem is along the entire spine. You will be able to see, the patient in live streaming will be able to see where exactly the pain and the other pathologies are, including segmental problems, including muscle spasm and tightness, that each one of you will be able to see if you undergo through his diagnostic and treatment tool. So we will be doing this. Please viewers, take a note. Even though our patient did not say that he has problem in the neck, but the Pulstar technology has picked up problems along the red bar area, which is basically C0, C1 area and also C6, C7 area, as you can see in the red bar. So greens are good, red is not good at all. So we have done the cervical section. We will go through the thoracic section, lumbar section and ultimately sacral section. Currently we are palpating and diagnosing thoracic region. This helps us to monitor inflammatory response like a nervoscope. Okay.
Central.
As you can note, that our patient actually along the spine has lots of problems. The yellow shows that his muscles are spasm or is tight. The red bar shows basically there are dysfunctions along the spine in different joints, like between L3, L4, S1, S2, S2, S3. The red bar between S2 and S3 shows that he has sacral joint, inflammatory response or any dysfunction that is going on. So currently we will be treating this part and see if we are able to eliminate the red bar, and that's why we know that okay, the treatment is successful. Look at the green bar. It shows us how much intensity impulses we have to apply.
L1.
So the computer itself will tell us where to give, how much to give, and for how long duration, the impulses, the forces, and even the rate at which we should be applying the pressure. Now you are able to see that previous graph was this, and we treated the lumbar section only with the sacrum because he had left SI joint dysfunction. Currently, post treatment, he has all green other than this lumbar 1, which is yellow, which means he has a little bit of muscle stiffness still present, and that we can take care of through exercises. Rest, all the segments of the lumbar vertebrae and the sacrum is all green, which means we have successfully treated him. And let's ask him if he has any pain or spasm at this point of time, what he was complaining of. He has actually touched till the floor with the knees straight. आपका कोई दर्द है, कुछ भी है? थोड़ा सा कितना आप बताएंगे? पहले तो आप 7, 7.5 शायद बताए थे, 2 के आसपास है अभी दर्द. दैट इज फैंटास्टिक. सो यहाँ पे उनका दर्द नहीं है, जो भी दर्द है यहाँ पे है, एंड इट इज पॉसिबल दैट वी हैव मसल्स कमिंग फ्रॉम ओवर हियर. L1 muscle is causing that pain coming down like this. So we will give him exercises to treat this, and he is done. right? So this is how we treat, and our treatment is fast, ड्रग फ्री, कोई दवा नहीं चाहिए, कुछ अलग सा कुछ ट्रीटमेंट करवाना नहीं चाहिए ताकि आप कुछ खाए, ये एकदम कोई साइड इफेक्ट्स इसका है नहीं, बहुत जल्दी ट्रीटमेंट खत्म हो जाता है, इनका इतना साल का दर्द कितना जल्दी कम हो गया. सो यू आर ऑल वेलकम. तो आपको कैसा लग रहा है अभी?
बहुत ही अच्छा लग रहा है. हम तो इतना दिन से सफर कर रहे थे.
ओके.
अभी कम है उसका, 1-2 का जैसा पेन है.
ओके ओके.
बहुत ही अच्छा लग रहा है.
थैंक यू सो मच. ऑल राइट, अंटिल नेक्स्ट टाइम, चियाओ, टेक केयर, गॉड ब्लेस, बाय.